What do you know about epilepsy? It's more common than you might think. Epilepsy is a neurological disorder that affects around 3 million individuals in the US alone. It's not confined to any specific age group and can impact anyone, from newborns to the elderly. The hallmark of epilepsy is abnormal electrical activity in the brain, which leads to seizures. These seizures can vary greatly in their manifestation. Some may cause just a momentary disruption of the senses, while others can lead to a full-blown convulsion that affects the entire body. Epilepsy is a complex disorder, and its understanding requires delving into various aspects, including its causes, types, symptoms, and treatment options. Now that we have a basic understanding of what epilepsy is, let's delve into its causes. So, what causes epilepsy? There's no one-size-fits-all answer. Epilepsy is a complex neurological condition with a multitude of potential causes. While it's a common condition, affecting around 3 million people in the United States alone, its origins can be as unique as the individuals it affects. One potential cause is genetics. Some types of epilepsy are known to run in families, suggesting a genetic influence. Researchers are constantly uncovering new information about how specific genes might contribute to the development of this disorder. But remember, just because there's a family history, it doesn't mean epilepsy is a guaranteed outcome. Genetics is just one piece of the puzzle. Then there are brain conditions. Conditions that damage or disrupt the normal functioning of the brain can lead to epilepsy. This includes brain tumors and strokes, which can cause abnormal electrical activity in the brain, the hallmark of epilepsy. Traumatic brain injuries, such as those sustained in a car accident or a fall, can also precipitate the condition. Infections, too, can trigger epilepsy. Diseases such as meningitis, AIDS, and viral encephalitis can cause inflammation in the brain that leads to seizures. Even conditions present at birth, like cerebral palsy or neurofibromatosis, can contribute to the development of epilepsy. But here's the tricky part. In many cases, the exact cause of epilepsy remains unknown. Despite advances in medical technology and understanding, for about half of all people with epilepsy, the cause is simply unidentifiable. This is referred to as idiopathic or cryptogenic epilepsy. In the end, epilepsy is a multifaceted disorder with no single cause. It's a condition that can emerge from the complex interplay of genetics, environmental factors, and brain conditions. And sometimes, despite our best efforts to understand it, epilepsy remains a mystery. While the exact cause can sometimes be elusive, recognizing the symptoms of epilepsy is crucial. So, let's dive into that next, shall we? The symptoms of epilepsy can be as diverse as the individuals it affects. Epilepsy, a neurological disorder characterized by abnormal brain activity, can manifest in a variety of ways. The symptoms can range from subtle to severe, making it sometimes challenging to identify. What's common, though, is the occurrence of repeated, unprovoked seizures. These seizures are brief episodes of involuntary movement that may involve a part of the body or the entire body, and sometimes followed by loss of consciousness and control of bowel or bladder function. One of the most common symptoms of epilepsy is temporary confusion. This could last for a few seconds to several minutes, where the individual may appear detached from their surroundings or seem lost in thought. The person might not respond to stimuli or might perform repetitive movements. Another symptom to look out for is staring spells. These can be so brief, they might go unnoticed. During these spells, the person might appear zoned out, unresponsive, and might not remember the episode afterwards. Uncontrollable jerking movements of arms and legs are also a symptom of epilepsy. These movements are usually rhythmic and can occur in one or all limbs. They can be subtle, with just a twitching of the fingers, or quite violent, with forceful flailing of the arms and legs. Loss of consciousness or awareness is another symptom that can be associated with epilepsy. During a seizure, a person may lose awareness, become confused, or even lose consciousness entirely. This can be particularly dangerous if the person is in a situation where a sudden loss of consciousness could lead to injury, such as swimming or driving. It's important to remember that these symptoms can vary greatly depending on the type of seizure a person is experiencing. Some seizures may involve a brief loss of awareness, while others may result in violent shaking, and some people might experience symptoms that are hardly noticeable, while others will have severe symptoms. Speaking of types of seizures, epilepsy is not a one-size-fits-all condition. Each individual's experience with epilepsy can be quite unique, and understanding these differences is crucial to managing this disorder effectively. Epilepsy is not a single condition, but a family of related disorders. Now that we've laid that out, let's delve into the two main categories of epileptic seizures: focal and generalized. Let's start with focal seizures. These are seizures that originate in just one part of the brain. Because they're localized, the symptoms can be quite specific, depending on the area of the brain affected. For instance, if the seizure originates in the part of the brain responsible for vision, you might experience visual disturbances. If it's in the area controlling motor functions, you might have twitching or jerking in one part of your body. The key takeaway here is that focal seizures can cause a wide range of symptoms, and they can be as subtle as a brief sense of déjà vu or as noticeable as uncontrollable jerking movements. On the other hand, we have generalized seizures. Unlike focal seizures, which start in one specific area, generalized seizures involve all areas of the brain. This broad involvement often leads to loss of consciousness, falls, or significant muscle spasms. There are several types of generalized seizures, including tonic-clonic seizures, which cause a sudden loss of consciousness, body stiffening and shaking, and absence seizures, which can cause brief lapses in awareness. But of course, the brain is an incredibly complex organ, and epilepsy isn't always so neatly categorized. Some people might experience seizures that start as focal and then become generalized. These are known as focal to bilateral tonic-clonic seizures. Understanding these types of seizures is crucial, not just for those with epilepsy, but for everyone. Recognizing the signs of a seizure can help ensure that those experiencing one get the help they need, when they need it. With a better understanding of the types of epilepsy, it's important to know how it is diagnosed and treated. That's what we'll be diving into in our next segment. Stay tuned as we continue to unravel the complexities of this common yet often misunderstood neurological condition. Diagnosing and treating epilepsy is a careful process tailored to the individual. When it comes to diagnosing epilepsy, the process is multifaceted and thorough. It often begins with a detailed examination of the individual's medical history, followed by a neurological examination to assess behavior, motor abilities, and mental function. To get a more precise understanding of what's happening in the brain, healthcare providers often turn to imaging tests. These might include an electroencephalogram, commonly known as an EEG, which captures the brain's electrical activity. Other tests like CT scans, MRI, or PET scans may also be used to visualize the brain's structure and function, helping to pinpoint areas that could be causing seizures. Diagnosis is a crucial step, but it's only the beginning. Once epilepsy is diagnosed, the focus shifts to treatment. And just like the diagnosis process, treatment is highly individualized. Most often, the first line of treatment for epilepsy is anti-seizure medications. These drugs are designed to decrease the frequency and intensity of seizures. However, it's important to note that finding the right medication and dosage can be a process of trial and error, requiring patience and close monitoring by a healthcare provider. In cases where medications aren't effective or cause severe side effects, other treatment options may be explored. This could involve surgery, where doctors remove the area of the brain causing seizures. Another option is a procedure known as brain stimulation, where electrical impulses are used to regulate abnormal brain activity. Epilepsy can be a challenging condition to live with, but it's important to remember that with the right treatment approach, many individuals with epilepsy can lead normal, healthy lives. Remember, epilepsy is a manageable condition with the right treatment and understanding. As we wrap up, it's important to summarize our key points about epilepsy. This common neurological disorder, affecting around 3 million people in the US alone, is characterized by abnormal electrical brain activity resulting in seizures. These seizures can manifest in various ways, from focal to generalized, each with distinct symptoms. Epilepsy can be sparked by various causes and can strike at any age, making it a condition that demands our attention and understanding. When it comes to diagnosis, a range of tests are deployed, including neurological exams and imaging. Treatment typically begins with medication, but in cases where this proves ineffective, surgery and brain stimulation may be considered. Throughout this journey, we've uncovered the multifaceted nature of epilepsy, delved into the causes, symptoms, and types, and explored the path to diagnosis and treatment. It's a testament to the complexity of the human brain and the ongoing efforts of the medical community to enhance our understanding and develop effective treatment options. With knowledge and understanding, we can better support those living with epilepsy in our communities. Remember, everyone's experience with epilepsy is unique, and understanding begins with awareness.